are you ready? Pull them in the tell me what you done. Let's go. Get it just like that.
Tetraplegia is one of the most forms of paralysis in the upper and lower body. This means that it affects both arms and both legs. This type of paralysis is typically due to damage to the spinal cord or brain. It affects all four limbs, and in some people it also affects parts of the chest, abdomen and back. There is currently no way to reverse the damage. However, some people may experience improvements in symptoms and the others may regain better or complete control over the affected areas with time. It affects different parts of the body depending on the person. It mostly affects the torso and limbs, but some people will also have paralysis of the neck, head and shoulders.
Hi, Assalamualaikum. My name is Nur Azrina Dalius and my metric number is DNS07212251. Before I talk about the anatomy of the spinal cord, I would like to share that the severe spinal cord or traumatic brain injury can have a variety of impacts on those who survive them. A common issue for these survivors is suffering some form of permanent paralysis because of the damage caused by the injury. With spinal cord injury, the type of paralysis suffered can vary depending on the nature of the injury and where it occurred. Spinal cord injury can be incomplete, which means totally severing the spinal cord, or incomplete, which only partially severing the spinal cord. Spinal cord is divided into several regions, which are, first of all, the cervical spine, numbered from C1 to C7. This is section of the spine contains the vertebrae that form the neck. Next, the thoracic spine, numbered from T1 to T12. The vertebrae here form the upper neck. Next, the lumbar spine, numbered from L1 to L5. These vertebrae are near the base of the spine. Additionally, the spinal cord itself ends somewhere near the L1 or L2 vertebra. The sacral spine, numbered from S1 to S5. This is the very end of the spinal column, but the spinal cord itself does not reach this region. Instead, the sacral spine contains spinal nerve.
Anatomy related to injury. First, C4 quadriplegia and tetraplegia result incomplete. C6 result in partial paralysis of hands and arms as well as lower body. T6 paraplegia result is paralysis below the chest. L1 is paraplegia result in paralysis below the waist.
Hi, Assalamualaikum. My name is Nashifika Azrian binti Muhammad Shukri. My metric number is 07212252. So now I will explain about the etiology of tetraplegia. Tetraplegia is caused by the damage to the brain or the spinal cord at a high level. The injury, which is known as a lesion, causes the loss of a partial or total function of all four limbs. But some people will also have paralysis of the neck, head and shoulder. Possible causes of such damage include fall or accident injuries, autoimmune condition like multiple sclerosis, neurological condition like stroke and cerebral palsy, tumors and lesions in the brain or spinal cord, and spinal cord infection from polio.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Azrati Azman Rashid binti Azman and my metric number is DNS07212256. In my part, I want to present about pathophysiology of tetraplegia disease. So first is destruction of cord parenchyma from direct trauma. It is because of corrosion by bone fragment, hematoma or dysmetrial. This injury is an acute impact or compression injury that causes a concussion of the spinal cord. In addition, this type of injury initiates a cascade of events focused in the gray matter and results in hemorrhagic necrosis. Second is ischemia from damage or impingement on spinal arteries. It shows that tetraplegia disease was caused when there is severe damage on the spinal artery, Compromised spinal cord perfusion and ischemia also can cause by hypovolemia and hemodynamic shock in patients due to excessive bleeding and neurogenic shock. Third, the injuries that occur above level C4 that often result in respiratory deficiency. It is because this form of paralysis typically the product of damage high in the spinal cord that usually in the cervical spine between C1 to C7.
Assalamualaikum. My name is Atika Sofia binti Hasbullah. My matric number DNS 0721202. I would like to present about clinical manifestation of tetraplegia. There are many of clinical manifestation of tetraplegia. The clinical manifestation are incontinence referred to uncontrollable urine leakage. Second, exaggerated reflex activities or spasm, feel pain, shortness of breath, breathing difficulties, inability to sense heat or cold and touch. Last but not least, special dysfunction, sexual sensitivity and fertility, coging, and the last, difficulty with balance and working.
Hai, Assalamualaikum. My name is Ella Nushahada binti Ibrahim, DNS 0721217. I will present about investigation of tetraplegia. To diagnose tetraplegia, we have to assess patient symptoms and medical history. For example, we can ask questions about any recent accident, or we can ask if the patient has any family history of certain conditions. There are many ways to investigate tetraplegia. Among them are from MRI scan. It uses a large magnetic radio wave and a computer to create a detailed cross-sectional image of internal organs and structures. MRI scan also can analyze of the brain and spinal cord. Other than that, MRI can scan the injuries or abnormalities of the joints, such as the back and knee. An MRI scan differs from CT scan and X-ray, as it does not use potential half-wave ionizing radiation. Next is CT scan. The CT scanner can see hundreds of different levels of density. It can see tissues within a solid organ. It can help to assess bone disease, bone density, and the state of the patient's spine. It also can provide vital data about injuries to a patient's hand, feet, and other skeletal structure. Even small bones are clearly visible as well as their surrounding tissues. The CT scan are different from X-ray machine, which send just one radiation beam. The CT scan produces a more detailed finer picture than X-ray. Last but not least, electrobiography or EMG. EMG is a diagnostic test that measures how well the muscle respond to the electrical signal emitted to specialized nerve cells called motor nerve. A doctor might order an EMG test if a person has symptoms of muscular or neurological condition such as numbness and unexplained weakness in the limbs.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Zazira binti Ruslan. My number index 10S07212214. I will explain about medication in tetraplegia. Medication can help improve quality of life after spinal cord injury by minimizing inflammation and providing relief pain secondary complications. First medication is corticosteroid such as methylprednisolone. This medication can help minimize damage in spinal cord injury. Second medication is NSAIDs like ibuprofen. Like we know, this medication can help relieve pain. And the third, antidepressants such as SSRI and SNRI. This medication can increase neurotransmitter in our brains. And next, anticonvulsant such as gabapentin. Then antibiotic, like we know, this medication can help prevent spread of infection and can help clear the lung mucus. And the last one is antispasmodic. Antispasmodic can help reduce the effect of cold. Thank you.
Assalamualaikum. My name is Siti Rabatul Adillah binti Zabida Agla DNS 07212198. I will talk about treatment, surgical and operation tetraplegia. First, upper extremity reconstruction surgery can restore some of the upper limb function in tetraplegia patient. 2. Unit transfer surgery, which releases start work the remaining functional muscle to restore active elbow extension, care grip and finger grasping. 3. Surgical reconstruction of the upper extremity was once limited to passive tenodesis, arthrodesis of major joints and internalization of the phalanx hanger spilling concept. Last but not least, surgical restoration of elbow and wrist extension and hand grip was the donation potential to improve autonomy, mobility and critical ability, for example, eating, personal care and self-caracterization and productive work in at least 70% of tetraplegia patients. Thank you. I will pass to next presentation. Bye.
The intervention. 1. Discal injury process, current prognosis and future expectation. Rationale to provide common knowledge base necessary for making informed choice and commitment to the therapeutic regimen. 2. Recommend applying abdominal binder before erasing tetraplegic and remind to change position slowly. Rationale to reduce falling of blood in abdomen and pelvis and minimizing postural hypotension. 3. Instruct improper skin care, respecting all skin areas, daily using adequate padding in bed and chair, and keeping skin dry. Rationale to reduce skin irritation and decreasing incidence of tissue-bitis. 4. Review dietary needs including adequate, bulk and luggage. Rationale to provide adequate nutrition to meet energy need, promote healing and prevent complication. 5. Identify symptoms to report immediately to healthcare provider. Rationale to prevent or minimize any complication. 6. Discuss sexual activity and reproductive concern. The rationale to concern about individual sexuality and resumption of activity is frequently an unspoken that needs to be addressed.
My name is Nurisa Zira binti Roslan. My number index dan 07212214. Potential nursing care plan. First, assessment. Subjective, patient complaints feel uncomfortable, and for objective, patient's skin is dry and flaky. Next, rough skin and swelling around the interstitial injury. Next, nursing diagnosis. Risk for impaired skin integrity related to permanent sensory loss and immobility.
For intervention, firstly, assess the overall condition of the patient's skin. Rationale to make sure patient have good turgor, feel warm and dry to the touch, be free from impairment and have quick capillary. Next, clean, dry and moisturized skin, particularly bony prominence twice daily or incontinence or sweating. Rationale, smooth, supply skin is resistant to injury. There's measure prevent evaporation away the skin. Next, reposition patient frequently. Rationale to improve circulation and reduce pressure on bony prominence. Encourage to avoid wearing tight clothing. Rationale, tight clothing can further irritate skin damage and rashes. Next, encourage continuation of regular exercise program. Rationale, it can help access mobility and advise on positioning and mobility aid. Next, encourage patient to should be in high in protein, vitamin and calories. Rationale to ensure minimal wasting of muscle and the maintenance of healthy skin. Last, encourage patient to drink a lot of water, more than 2 liters. Rationale to keep hydrated and avoid skin dryness.
Assalamualaikum, my name is Azura binti Salimin. My matric number is 10S07212250. Next, rehabilitation. In the process of helping an individual achieve the highest level of function, independence and quality of life possible. Rehabilitation does not reverse or undo the damage caused by disease or trauma, but rather help restore the individual to optimal health, functioning and well-being.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nuriza Sira binti Roslan. My number index is 07212224. Physiotherapy. Physiotherapy for people with a complete spinal cord injury will concentrate on maintaining tissue capability, increasing muscle strength, and maximizing potential and promoting independence. The treatment will focus on first, increasing muscle strength, second, maintaining muscle and tissue strength, third, muscle strength below the level of injury, fourth, regular standing to wake bear and improve function of the internal organ. Next, exercise to improve balance and confidence. 6. Teaching wheelchair skill. 7. Breathing control and assisted coughing. 8. Teaching transfer such as bed to wheelchair or wheelchair to the bed. 9. Advice to the orthotic device. Next, advice on positioning. 11. Improving safety, then increasing energy level. 13. Reducing pain and muscle spasm. 14. Hydrotherapy treatment. Thank you.
Assalamualaikum. My name is Siti Rabiatul Adila binti Zabidi Akla dan S07212198. I will talk about occupational therapy tetraplegia. First, eating with additive utensil and blood clot. Patients who have limited breath control may benefit from using a blood clot, which creates a barrier around the blood to prevent spilling. 2. Roaming with universal scarf. These items like hair brushes and toothbrush can be attached to the universal cuff and then slip onto the hand to avoid being dropped. 3. Using a raised toilet seat. A raised toilet seat may reduce the height difference between a patient wheelchair and the toilet seat, making the seat easy to get on off from, and can minimize pressure on the joints. 4. Using reaches to grab out objects. An occupational therapist may recommend using the reach as an extension of the arm. Reaches can also assist some patients with getting their feet through their bent legs when getting dressed. Last but not least, installing grabs, bar and rails for self-transfer. This should be used with caution as the suction may not always hold, especially in an area with changing temperature and humidity like the shower. Next, I will pass to the presentation. Bye.
Next, I will present about complication of tetraplegia. Depending on the level of the injury, patients with tetraplegia have different clinical presentations. In general, all patients have motor and sensory deficits in the arm, trunk, and legs. If the spinal cord are torn, it will likely have better prognosis. But when the spinal cord is crushed, the decompression is urgent within 2 to 3 hours. Otherwise, the prognosis will worse. The most complications of tetraplegia are respiratory problems such as atelectasis, hypertension, bronchospasm, pulmonary edema, and pneumonia. Next, pulmonary thromboembolism and other embolisms such as blood clots, urinary and pulmonary infections, pressure sores, spastic muscles, loss of bladder and bowel control, and lastly are pain.
Next, we will talk about procedure of log rolling. The objective of log rolling is maintain proper anatomical alignment in an effort to prevent the possibility of future neurological injury and to prevent stress on the injured area. Log rolling is a technique used to turn a patient whose body must at all times be kept in a straight alignment, like a log. This technique is used for a patient who has a spinal injury and used for a patient who must be turned in one movement without twisting.
Log rolling is a common patient care procedure performed by many healthcare workers. The indication here means something that serves to indicate or something that is indicated as advisable or necessary. There are several indications of log rolling which are: first of all, any patient arriving on the playground in the emergency department. Second, assessment of posterior traumatic injuries. Third, perform as early as possible after arrival to prevent skin breakdown from facial ulcer. Next, use the term patient whose body must all times be kept in straight alignment. Next, use for patient who has spinal injury. Lastly, use for patient who must be trained in one movement without twisting.
So, the items that we use in this procedure is a protective face mask. It is to prevent entry of pathogen through the airways and have the role of protecting both the wearer and the surrounding people. Next, we also use buffing caps to prevent stray hair from contaminating a work area in laboratories, medical facilities, and clean rooms where sterility is mandatory. A medical gloves is important to help prevent cross-contamination between caregivers and patients. In addition, we also need the medical gowns to protect the wearer from the spread of infection or illness if the wearer comes in contact with potentially infectious liquid and solid material. Besides, the importance of spine board is to provide ready support during movement of a patient with suspected spinal or limb injuries. To prevent a further cervical spine injury in the management of trauma patients, we use a semi-rigid cervical collar in this procedure. Lastly, a roll towels or blanket placed against either side of a patient's head is to maintain a proper spinal alignment of the patient's head and neck.
Step of procedure. Step 1. Give the patient position without applying traction. He should grip the patient's shoulder at the neck and gently position the patient's head between the forearm. Another rescuer should apply a semi-grade extrication collar. Step 2. Place the patient's legs and arms extended in the normal manner. The patient will be rolled out on one arm and that arm, providing proper spacing and acting as a spill of the body. Step 3. The long leg broad position next to the body. If one of the patient's arm is injured, place the background on the injured side so that the patient will be rolled out on uninjured side. Step 4. Position the man's chest and upper leg. Step 5. Rescuer to hold the patient near arm in place. He then reaches across the patient and grabs the shoulder and the hip, holding the patient forearm in place. Step 6. Rescuer 3 reaches out the patient and hold the leg. Step 7. Rescuer 1 gives the order to log rolling the patient. When everyone is ready, Rescuer 1 at the head and give the order to log rolling the patient. Step 8. Rescuer carefully roll out the patient up on side toward them. Rescuer 1 carefully maintain the head and neck in natural position during the roll. The patient's arms are kept locked to her side to maintain a spilling effect. Step 9. Rescuer examines the injury. Rescuer 2 quickly examines the posterior surface from acute to heels of injury. And the last step is rescuer put the patient onto the spine board.
Responsibility pre-operative care. Number 1. Greet the client and explain the procedure. Number 2. Wash hand. Number 3. Provide privacy patient. 4. Lock wheel of the bed. 5. Stand beside client's shoulder. Fashion head of the bed. Sit. Lower the body by flexing knee. Last, number 7 is place shoulder under client's axilla.
First, help move an injured individual by rolling them. This method is used when a person is injured and needs to be moved or transported by other people. Second, find 3 or 4 other people to help. Keeping the spine stabilized and maintaining consistent motion is vital to successful log roll, and a minimum of 4 people is needed to do that. Next, appoint a leader. The leader will be in charge of coordinating movement and maintaining the patient's head and neck alignment. The other helpers will take orders from the leader and perform tasks such as rolling the injured person onto their side, inserting a stretcher underneath them, or performing bandaging if necessary. Next, roll the injured person onto their side. On the leader command, the helpers will roll the injured onto their side. Each helper must place one hand under the injured person's back and reach their other arm across the top of the injured person's body to grab the opposite side of them. The helpers will then roll the injured person toward them so that the injured person ends up on their side. As a helpers move the injured person, the leader must keep turns. Last, place the injured person on stretcher. Once the injured person has been rolled onto their side, the designated helper will slide the stretcher underneath them. The rest of the helpers will then roll the body back down onto the stretcher.
Now, I will continue with the post-op care of log rolling. Number 1, check the patient condition and vital sign for abnormalities in the body of the patient. Number 2, perform the neurovascular assessment frequently to look for indication of circulation impairment. Number 3, place pillow in front of and behind the patient's trunk to support his or her alignment. Number 4, provide for patient safety such as place personal item within easy reach. Number 5, ensure that the side wrists are up and secure to prevent the patient from falling out of bed. For the summary, log rolling is a technique used to turn a patient whose body must at all times be kept in straight alignment like a log. The indication of log rolling most used for patient with spinal cord problem or used to turn a patient whose body must all times be kept in a straight alignment. In this procedure, the caregiver needs to ensure a safety between the patient and the caregiver. This procedure also requires a spine board, a semi-rigid cervical collar, and a roll towel that places against either side of a patient's head to maintain the patient's spinal alignment. Rescuer must provide stability to the patient on the head and neck with a semi-rigid release collar and place the patient on the spine board by rolling the patient to the uninjured.